I can only assume how hectic life has been throughout 2020 as a medical practitioner,
Yeah.
just in general, working in the communities that you work in. What can you tell us at this point about the vaccine? I'm sure maybe people have some questions, so just kind of jump in wherever you want to.
All right. So I will tell you, at least for myself, and my process with the vaccine, I am one dose in, get my second dose next week. My wife, who is also a physician, she got both of her doses because she's doing a lot of inpatient and has been over the past year, like doing inpatient about like maybe once or twice a month, and obviously taking care of many patients that have COVID-19. And so we all know how hard it has hit our communities in particular. And so with the previous administration, which thank God went out, there was a lot of, honestly, I say like ignorance and ignoring the situation and not really addressing it. Part of it is getting a vaccine, but the other piece, which needed to last us until the vaccine came out, is obviously with the face masks and the physical distancing and ensuring that messaging. That was a missed opportunity, but we are where we are now. I got an update this morning, and it sounds like, at least in our community, at least where Friend Health is doing testing, the numbers are starting to go back down after the bump that happened, like during Thanksgiving and then Christmas travel. Because again, if the messaging isn't consistent, people will think it's not real, or they can do what they normally do, but just not shake hands and it's going to be okay. And so I'm glad that the numbers are starting to go down, but one of the best things that we have kind of in our arsenal is the vaccine. And so just so that it's kind of a brief little summary, this vaccine is something different than the vaccines that have come before, not only because of the Warp Speed program that kind of green lit it jumping from research to human subjects. Essentially, what got bypassed in the Warp Speed segment was the animal testing. And that's the piece that for most vaccines that have come before has lasted for years. And so that is essentially the shortcut. And so with that, I know there's a lot of reservation because it happened a lot faster, because we don't have any human results or data that are older than a year. And so inherently, and understandably, we have a lot of distrust with the medical, community and kind of institution as a whole because of things that have happened in the past. And so that's part of the reason we have folks like Barack Obama, like Mayor Lightfoot, like a lot of people who are trying to take it publicly to build confidence in it. I feel as if that's all fine and good, but confidence comes from knowing, like what it is that you're going to be receiving, how it's going to work, and what the risks and benefits are for you specifically. And so this vaccine, when I said it's a little different, it is an mRNA vaccine. And so just to summarize what that means, when they inject you, what they're injecting you with is not COVID-19. It is essentially a RNA strand that then gets incorporated into your cells and produces a protein that the virus produces. That is what mounts the immune response. And so that's what you get essentially in dose 1 and dose 2 of the vaccine, and why a lot of people, with apparently my wife being an exception, a lot of people that I know, when they got the second vaccine, because their body had already mounted an immune response, they had symptoms similar to a COVID-19 infection. So they would have kind of sometimes fevers, chills, most consistently, it was headache and kind of muscle ache. So it sounds a lot like a flu. And so for my wife and maybe one other person, they got their second dose and were completely fine, went on about their business. I won't know for me until I get it next Friday, exactly like what it's going to be, but kind of getting to that risk and benefit piece. If you are going to be around, like for me, kids, like patients, families, it's a no-brainer for me, because if I can ensure that I have immunity, it means I can't pass it on. And the biggest, like kind of reason why for both myself and my wife, we opted to get it is because even with the limited data that we have right now, like I said, it's at the most maybe 10 or 11 months. We know that the immunity produced by the vaccine lasts longer than the immunity if you actually get COVID-19. That's the important piece, because the COVID-19 immunity maybe lasts about 3 months. We know that it's at least 6, 7 months that you are protected. As like the trials and everything continue, we'll find out if it lasts longer than that, if it lasts for a year, if it lasts for 2 years, or if it lasts presumably for a lifetime. Those are the questions that we can't answer right now. But in terms of the safety, we're confident with the safety profile that there's not, like, people aren't growing a third eye, web feet, like anything, like out of the ordinary. And for me, in terms of my practice of pediatrics, because kids can't get the vaccine, it's up to me to make sure that I get it to protect them, because they can't get it for themselves because it hasn't been studied in kids. And so that's kind of the, like, little nugget that I wanted to share and kind of open it up for any questions, because I definitely encourage, like a CYP is about the youth. And so making sure that we have a safe place for them to be. But like I said, risk and benefit. So you've got to know for yourself, because if you've got, like conditions that make you vulnerable, then I would definitely lean towards getting it, because the benefits outweigh the risks of not knowing what's going to happen a year or 2 years from now. If you, are going to continue doing in person, like when we get beyond Zoom, again, making sure that you're protected so that you're not passing it on to anybody else. And this is how we build kind of this kind of collective immunity, and we're really able to beat COVID-19 down.
Questions for Dr. Jordan? Miss Autry. Then I see Mrs. Omani.
So you kind of answered all my questions, Dr. Jordan. Thank you so much. But one question I have, that even though we get the vaccination, we're still to wear masks, correct?
That is correct.
Now, what about the thing that Fauci was just talking about, that we may have to double mask because of this new strain that's coming out? Give me your thoughts on the double mask.
So I haven't really taken to double masking yet, but I'm doing mask and eye shield, which essentially covers my entire face. So that is essentially equivalent. I think when he's talking about that, he's talking about as we kind of come and go, the potential of double masking. For me, it's most important that we wear masks properly. And so if we wear them properly, and again, maintain kind of that physical distancing, we're not out hanging out for hours at a time, because all of this is contingent upon the fact that we're not staying in a space, like say in an enclosed area with someone, say, who might potentially have it, and several people who don't, breathing the same air over time, over hours. It's meant to be, like when you're at the grocery store, when you're, like at your places, you're moving through, the air obviously is circulating. You're not there for a long time. You're in and you're out. That's what's gonna kind of be the safest. And so double masking may very well be helpful if you're in a situation where you can't avoid, like being able to get out of the space or, like things like that, it can be helpful. But even then, making sure you continue to wash your hands, because sometimes it's touching, like the same doorknobs. And so you might think, well, I got the mask on, so I'm all good. Now I'm going to eat something, and it can be passed that way. So it's still paying attention to all of those other things. So the hand hygiene, masking, and social distance or physical distancing. Thank you. Thank you.
Mrs. Omani was next. And then I see
All right.
Miss Tammy, I think, and Miss Karen.
Hello. Thank you so
Hello.
much for the information so far. I just had a quick question. I know that the vaccines, I think there's like 2 or 3 of them out. What is the difference between those? So I know like they have like Merck and Company has paired up with this new company, and they have like that MK7110 that has come out, and it's supposed to be more for patients that have COVID, really severe versions of COVID, but they're also giving it to those that don't have or never have had COVID. And then you have like Pfizer and Moderna that have, so what is to say what facility is using what vaccine, what we should be more, which we should be more in favor of? And if we're given the option of this MK7110, should we be okay with taking it? Yeah.
Okay. No, and those are great questions, because they're competing essentially. It is my understanding, I want to say Pfizer came out first. And Pfizer was done without any government funding, like additional government funding, versus Moderna, which did receive some grant funding from it. Merck, I think, did their own thing. The biggest difference in terms of what we're seeing for side effect profile and everything for the two, like there's not very much that's different with the Moderna and the Pfizer. The biggest difference was one of the things that would help in the rollout, which was the difference in the storage temperature that they needed to be kept at, because the Pfizer one needed to be like sub-zero, so almost like 30, 40 degrees. And part of like the failures with the rollout is like when you thaw it, you have to use it. And so you have to have, like people show up for their appointment, show up when they need to be there so that it can be given and not wasted. And I think New York had some issues where they wound up kind of wasting a lot because it wasn't used in time. And so that's one of the important pieces, regardless of which vaccine. Like I said, like kind of the safety profile and everything for both the Moderna and Pfizer. I'm not entirely certain about Merck, but I know they were all competing kind of like 94%, like covered 95% coverage. Like they're all going to be, like mid to high 90s. They will all make sure that you generate an immune response. And so whichever one, like is accessible, there's not, like sufficient data to say that you should pick one over another. If that changes, obviously I can. Go ahead.
Can I ask one more on top of that?
Yeah.
Very quickly.
Real quick, is it true that they're using breast milk as an option as it's anti-inflammatory?
As an option for what?
Yeah, as an option for yeah, I've been reading about that too, because it's an anti-inflammatory something. They've been talking about the use of breast milk for helping to treat COVID patients.
So that's not something that I have heard. They've tried a few things, but learned really quickly what works and what doesn't. The drug that had a fan in our former president, hydroxychloroquine, was never one that was shown to work and never yielded good results. There have been cocktails and antivirals that have been found over, like use, like kind of this emergency use, which is really what all of these vaccines are licensed for. It's for emergency use so that we can get as many people vaccinated as possible and protect, like as many Americans and, like as we can, because we've lost almost 400,000 people to this virus. And so that's, again, for risk benefit, that's always going to outweigh. It's like, because we don't know who's going to get hit and get hit hard, because I've lost folks like at my church who were older, who were younger, who were, like it's not that you can predict, because we think if you're more vulnerable, if you've got more conditions like that, if you get hit and your body's systems start kind of shutting down, oh, then your diabetes is going to do this, or your asthma is going to do this. It doesn't necessarily always work out that way, because there are some who are younger, like 40s, 50s, in good health and still succumb. Getting back to your question about the breast milk, I'm gonna have to look into that, like to see breast milk does contain antibodies, but I don't know if what they're looking at is breast milk from women who were pregnant, gave birth, and tested positive, if they're thinking there might be some protective antibodies there, but that's not something that I've heard about, at least in terms of therapy.
Thank you.
Oh yeah, you're welcome.
I have
Miss Tammy.
Yeah, Dr. Ezekiel was at my church last Wednesday evening.
Wonderful.
And Omani, that question was raised, and her answer to that question was no, regarding the breast milk, that wasn't true. My question for you, doctor, is are there any pre-existing conditions or medications that people are taking that they should be concerned about when having prior to having the shot?
So really, like in terms of, because it sounds like your question is like contraindications, medications that would prevent you from being able to take it.
Yes.
The main things that you want to consult your physician about are immunological, medication, so immune modulating medication, so ones that will cause your immune response to be decreased. Most often when you would be dealing with that is if you're on like some sort of cancer, therapy, or with severe autoimmune diseases. And so that's something that, even though it's not a contraindication to it, obviously we don't want you thinking you're protected, but because your immune system has been weakened, like in the case of immune modulating medications intentionally, because it's been decreased to try and, help decrease kind of a cancer response. We don't want you thinking you're protected and you're not. And so a lot of times in those situations, what will be done is they may actually check your antibody level afterward, just to ensure that you did mount a sufficient response to offer the protection.
Very good. Thank you.
And Miss Karen had a question.
Okay, thank you.
Wrap it up.
Yeah, thank you. I appreciate the information. I just had the second shingle shot. How long am I supposed to wait before I can safely get the COVID vaccine?
All right, another excellent question. Y'all bringing it today. So 4 weeks is essentially the guideline that we use for live vaccines, of which like shingles or varicella, MMR is like our obvious examples of that. Used to be the intranasal flu as well, but we haven't been using that one honestly for a couple of years now. But you want to give, your body enough time to adequately adjust and respond, like with the immune response to the shingles vaccine. And so for some folks, we've been saying, one, if you have recently received a live vaccine, then wait about that 4 weeks. But for those who recently had COVID-19, because there is, again, kind of that 3-month window of the native or natural immunity that you get from it, we've kind of been guiding folks to delay getting vaccine in that situation as well, so that it's beyond that 3-month window, so that again, you will have a good and kind of boosted immune response.
Okay, thank you.
Awesome questions, everybody. Dr. J,
Yeah.
as I call you, thank you so much for joining us again.
My
We are
pleasure.
happy to see you, happy to have you.